The wait times, I think, are one of the major issues, and I feel in terms of satisfaction with my job, wait times is probably one of the biggest things that is leading me to feel dissatisfied with what I do. When I come out of the office after working 8 or 10 hours, and I can count on more than one hand the number of people that I've seen that I don't feel happy with the care that I've given them, then I start to feel burnt out. And I could go on and on with examples of that sort of thing. Most of you have family, yourselves, or friends who've gone through that. I see patients every day with cancer, with major illnesses, and I feel very badly when I say to them, I will do my best to get you seen as quickly as possible. And at the end of the day, I realize that as quickly as possible in lots of cases is 6, 8, 10, 12 weeks. I go home thinking, I practice feeling that I would like to treat every patient like my own family, and I certainly would not be happy if my mother had to wait 6 or 8 or 10 weeks for an urgent appointment. One of the other big problems in family practice is that our patients are aging, and for a lot of reasons, our patients age as we do. Obviously, when I first started in practice, I was only in my early 20s, and most of my patients then were roughly the same age as I am. I had a patient the other day who said to me, have you taken a lot of new patients? Because it seems like all of a sudden it's getting much more difficult to get in to see you. My average wait time now for an appointment is about 2.5 to 3 weeks. And I said to her, after thinking about it, I said, no, I haven't taken new patients in at least 12 years. But I said, what has happened is all of my patients who were 30 are now 60. And I jokingly said to her that you can deal with problems for most 30-year-olds in 5 minutes. You can't deal with any problems for 60-year-olds in 5 minutes. And if a patient has to wait 3 weeks to get in to see me, they have a list of concerns when they come. Some of them jokingly will say, I've saved it all up for you, not realizing that in saving it up, it's going to take me a half an hour to just skim the surface of their problems. And the visit that they have scheduled is probably supposed to take 10 to 15 minutes. And when I explain that to people, they say, wow, I can certainly understand why you get backed up. I think the thing that worries me the most about family practice nowadays is the whole idea of patient care and safety. I feel that even after 30 years, I'm still a very good physician. I do a lot of continuing medical education. I do try to keep myself as up to date as I can, but I still feel that there are so many areas where I can't provide the service that I would like to provide because my hands are tied. I see the patient, I diagnose them, I attempt to access the services and the appointments with specialists that they need, and I'm constantly stymied because of the fact that the access to these specialists and the access to these services is so slow. I'll just give you a couple of really quick examples. I have a patient who I saw last week who sounded as though he had a slip disc. He was having back pain and leg pain. He'd had it for 2 months. I told him and his wife, who was also a patient of mine, that I would have him seen as soon as possible. He wasn't considered urgent because he'd had the pain for 2 months and he could cope with the pain. I set up an appointment with a neurosurgeon. The appointment was for September. The family were grateful that they had somewhere to go. That night, he rolled over in bed and pulled his disc out, and it started to press on a nerve. The wife called me the next day and said, he's been crying for 4 hours. He's in racks of pain. You have to do something. I said, don't worry. I will call and get it looked after. It took 7 phone calls. He finally had his test done. He finally saw the specialist. Now, I'm not saying anything bad about the specialist. I called 2 neurosurgeons that morning. They answered me back within a half an hour. Their hands were tied as well because of access to testing. When I phoned the patient back and told her I had an emergency CAT scan booked for her the following week, she said, thank you, Dr. Callahan. I can't thank you enough. I said, I feel really badly that you have to wait a week for this test. She said, before I called you this morning, I would have had to wait till September. And I thought, how sad is that people have to be complacent because they have an urgent test that they should be able to have today moved up to next week from September. I find that very sad, and I find that it's very difficult for me to face that every single day when I know if things were done to improve the system, patients would not have to go through that. I had a 22-year-old last week who came in for follow-up of abdominal pain that she saw me for some months ago. When I saw her, I thought she might have had an ovarian cyst. I ordered an ultrasound. She came back 3 days ago to see me in the office to follow up on her ultrasound, which did show that she had an ovarian cyst, and I booked an appointment for the specialist. That appointment is for next October. So that will be a full year for that patient to be seen for something that I could diagnose the first day she walked into my office. I had a patient yesterday with breast cancer who had a new lump and had a biopsy done 6 weeks ago and is still waiting for the results of her biopsy. That's the sort of thing that we face all day, every day. That's one patient out of all the patients that I see, each of those examples. So you can certainly understand why we are upset with a system that stymies us every step we take. Paperwork is another issue. Paperwork, as I've mentioned before, is something that is a necessary evil. We have to do it. But I find that over the last 4 or 5 years, the paperwork has just gone up so much that it's almost impossible to keep on top of it. I attended a conference on the mainland last year when I was president of the Medical Association, and I was fascinated to learn that in BC and Ontario, they have a program called Advanced Access. And this is a program where you decide that you can change the way your patients are being seen in your office. And what you do is change your way of practicing so that you don't book all of your appointments. You book some appointments during the day and you leave the rest of the day open so patients can come the day they need an appointment. The problem with it is you have to have a certain number of patients on your roster, they call it. So I came back very excited with this idea that I would be able to bring my wait time down from 3 weeks to 1 day and counted the number of patients that I had. The number of patients they suggest that you can do this with is 12 to 1,500 active patients. When I counted my patients, I have almost double that. So I realized that being excited about this advanced access would only work if we have more family physicians to come so that we will be able to see the number of patients that are suggested by those programs. It's very difficult to entice new doctors into family practice in Newfoundland, and there's a number of reasons for that. But one of the biggest reasons is a reason that's happening across the country, and that is that most medical students who come out now have six-figure debt. Most medical students come out owing at least in the vicinity of $120,000 or $125,000. To finance that debt is equivalent to a mortgage nowadays, a small mortgage, mind you, but equivalent to a mortgage nowadays. When I first started in practice 31 years ago, my student loan cost me $39 a month to repay. Didn't really matter where I practiced. Wasn't difficult to come up with $39 a month. But to come up with the financing for $125,000 of debt is quite difficult. If you look at the provinces, if you're planning on staying in Canada, and you look at the pay, the number one thing that you see is that family physicians are historically paid less than specialists. So if you're in your last year of medical school and you're trying to figure out how you're going to finance that debt, then chances are you're going to look at something that's going to give you a chance of paying that off, being able to buy a house, being able to start a family. So if you're going to come to an area where historically family physicians are the lowest paid, and you're going to look at the amount of pay that you're going to get, and then you sit down with your financial advisor and they say, remember now, when you get this amount of money, you're going to pay out 1/3 to income tax and 1/3 to office overhead. And then you say, well, what's office overhead? Well, that's the money you're going to have to pay to rent your office, to pay your secretaries, to buy your supplies, and then you're going to take home 1/3 of what you make. It's not rocket science to realize that a lot of these young people have to very seriously consider where they're going to set up shop.